So I guess in wrapping all of this up, you probably noticed that from the HARP team, or the HIV/AIDS related programs team who we work for, we take a very sex positive approach, okay? Sex should be something that should be fun and should be pleasurable and meaningful for everybody, but we do recognise that some people unfortunately don't have positive sexual experiences. So do very much acknowledge that, and we do, when those situations come up, we work with those people to then access support around those situations so that hopefully they can then go on to have meaningful positive experiences throughout the rest of their life. Through sex positivity, we're encouraging young people to own their sexuality, okay? Own who it is that you're identifying with as an individual. Own the fact that you have those sexual thoughts and feelings, and that potentially you'll want to act on those thoughts and feelings. So sex shouldn't be seen as shameful, okay? Young people shouldn't be embarrassed or shamed about talking about sex. We've spoken so much about the fact that it's an integral part of being a human. So don't be shamed by having those thoughts. And that we're really working with young people to make sure that they are informed and therefore making safer choices when it comes to all things relationships and sexual health. And that finally, being sex positive and educating young people about sex does not make them engage in sex at an earlier age. I think a lot of parents, carers and workers are really hesitant to have those conversations with young people because it's like, if we talk about it, they'll want to go out and do it. Research actually shows the opposite, that they are more likely to delay those first sexual experiences having the knowledge and education because they're making informed choices. They're more aware of the potential outcomes of sex and sexual behaviours, and therefore they're more protecting themselves. So don't be afraid to engage in those conversations because it's not going to make them rush out and start having sex. So it's about talking soon, so starting the conversations with your young people from when they are very young in an age-appropriate manner. Talking often, it's not just having that one-off lecture, it's having those conversations frequently, those little snippets during teachable moments, and talk now, okay? It's never too early to start those conversations, but it's also never too late to start the conversations. So if you have young people in your care, young people who are coming up to you, start conversations about sexual health because it's so integral to the broader part of their life and their being as a young person.